Thank you so much, sir, for coming to a Leaders Roundtable organized by Voice of Healthcare and supported by Wolters Kluwer. Sir, I would like to know your views about this event and how do you think such kind of roundtables and events can shape the development and can enhance more of clinical researchers in India?
Namaskar. I am Dr. Puneet Gupta, Chairman Anti-Cancer Care Services, Faridabad Asian Cancer Center, India. Yeah, Kluwer has done this great facilitation, and in this event basically we emphasize that we have to develop something as a national level. We have to make a infrastructure, or we have to make a we can say a networking where, let's say, we have all the health data, let's say EHR record system at the national level. We have to create a resource which we can mine the data, we can mine later on, and this data first we have to pull a population based or community based, national based data that we can use for a later research as per the priorities of the nation. So we must know our health problems based on the community and the national data.
Thank you for your views, sir. So also I would like to know, we were having a great discussion inside. So amongst the topic which we were discussing about, I would like to know how has the introduction of AI and evidence-based practice influenced medical researchers in India?
See, AI, machine learning is the way forward. We have to understand that we have to create a special need based AI for India. We cannot copy American, European, Japanese, Israel, or all these people's data. We cannot extrapolate. We cannot use Cochrane, I will say, the database and their retrospective studies or prospective studies for our people. We have to create our own. So number one important is we have to create a national resource. We have to create a national database, and that AI now will help us in two ways. Number one, we have to create two options for each of our clinicians. This data should help our doctors. It should not be just for academic reason, but it should help the data for day to day treatment basis, that we should make all the algorithm or workflow patterns in two ways. Number one, to just make sure that what we can do in a research, what we say rich resource setting. Let's say we are treating a patient in Apollo Hospital, Max Hospital, Fortis Hospital, or Premier Hospital like say AIMS or Safdarjung Hospital. But second way, we are treating a patient in the village. So we have to say let's say there is a bleeding, patient is bleeding. So what we can do in a rich resource setting and what we can do in a poor resource setting within the same country. So this here AI will help us. AI will ask the question, okay, you are in a rich resource setting or you are in a poor resource setting. So it should give both the options, and this guideline should be based on a national basis. Give us options. We can select option A, B, C, D, E. Then we say, okay, what is available locally, what is available in the rich resource setting, and these should be updated constantly. What is the most demanding is that we should use a AI which is updated frequently and on, you can say, monthly basis or yearly basis. So that's very, very important. So AI, with a meaningful AI we have to use, and that should be used on day to day basis, not only for research or producing a research paper, but for making the doctors go through the problems on day to day basis.
Thanks a lot, sir. You said it well, and thank you so much for those words, and thank you so much for coming to this event and giving us your valuable inputs. Thanks a lot,
It's
sir.
my pleasure. Namaskar.
Thank you.